We have all, at some point, taken one of these, perhaps for a simple headache or for a more serious ailment. A pill. Just by looking at it, we cannot know exactly what it contains, but we entrust our health to this tiny, mysterious object. Usually, we are quite right in doing so. Yet every single day in the world, thousands of people are finding out that this trust has been misplaced. The counterfeit industry has found a new, particularly lucrative market: counterfeit medicines. Mr. and Mrs. Yu are among the innocent victims of this industry. When their son fell ill with malaria, his condition deteriorated rapidly, in spite of the locally bought medicine. They took him to the hospital several kilometers from their small village in Cambodia. Here, the doctors treating the little boy told them that the malaria medicine they had bought in their village was probably counterfeit. That's why it did not cure the child. By now, the disease had reached a critical stage. There was nothing they could do to save the youngster. Someone, somewhere, had decided that human lives are worth nothing at all, that they are less important than the money to be made selling tablets of death to the innocent. This is by no means an isolated case.
Only last week we had admitted a man on the northwestern border of Thailand unconscious with cerebral malaria, and he sadly died the next day. The drug that his relatives brought with him looked absolutely identical with genuine artesunate. The packet was perfect, the tablets itself, but there was nothing in it.
Trafficking in counterfeit medicines is part of a multi-billion-dollar industry that has tentacles in just about every country in the world.
The scale and extent of counterfeiting globally is a truly difficult and widespread problem. Organised crime is actually gripping this problem, and criminal organisations are using the international trading system for their benefit. They don't have the costs of research and development. They are able to use cheap and effective means of transport. They're well organised, and counterfeiting has become systematic, repeated and systematic. Container loads of goods are being imported and exported, and the use of free zones, and every product you could imagine is being counterfeited. The biggest concern for many of us are the goods that actually damage health and consumers, and perhaps the most difficult and severe problem is with regard to pharmaceutical products. I think it's true to say that all countries of the world are at risk from counterfeit pharmaceuticals.
As was noted in a recent report by the US Food and Drug Administration, the counterfeiting of drugs indeed has another dimension. Counterfeiting of medications is a particularly insidious practice. Drug counterfeiters not only defraud consumers, they also deny ill patients the therapies that can alleviate suffering and save lives. Counterfeit drugs were responsible for the death of Mr. Yu's son and countless others. It is a cold-blooded crime against which most people will be powerless if no action is taken. But what are these fake drugs? Take these two boxes. Can you make out which is genuine and which is a copy? Take these two tablets. Is there any visually recognizable difference? With the most sophisticated counterfeits, there are no differences that the eye can see. The difference lies in what is inside. A fake medicine may contain none of the ingredients that are meant to treat disease. They may contain too little of these ingredients, or they may contain entirely wrong ingredients. All these cases are harmful and, ultimately, lethal. Anything can be faked: the label, the package, the tablet, the expiry date. The ingenuity of the producers of counterfeit products knows no bounds. Usually, these kinds of products are sold at a cheaper price than the genuine ones. No country, rich or poor, is safe. The United States Food and Drug Administration estimates that counterfeits make up more than 10% of the global medicine market. The annual earnings, over $32 billion globally. Mr. Yu is from Cambodia, one of the countries of the Mekong region that are particularly affected by the problem of counterfeit anti-malarial drugs. The countries of the region are linked geographically, commercially, and culturally. Unfortunately, this proximity also allows disease and counterfeit products to cross borders with dangerous ease. Malaria has always been a serious problem here. Throughout the region, malaria incidence is closely related to the environment and is usually most rampant in hilly forested areas. Poverty and living conditions are important factors in transmission. It also affects migrants engaged in cultivation, mining, and cross-border trade. Malaria is the second largest killer in the world today, after AIDS. 1 million people die of the disease every year. Up to now, no vaccine has been found against this disease. Drug resistance is a major problem that weakens the efficacy of the known drugs used to combat the disease. The health authorities in the Mekong region countries have applied various measures to turn the situation around. Strong political commitment has helped to control the spread of malaria. This has been achieved by improving access to care, strengthening the health infrastructure, providing anti-malarial treatment free of charge or at low cost, ensuring a reliable supply of drugs, and applying vector control measures. Incidence has been decreasing in most countries of Asia, but not nearly enough. Yet, hope is at hand. This plant is called sweet wormwood, or Qinghaosu, in China. Its healing properties have been known for millennia. It was first mentioned in medical texts dating back to 2,000 years as a treatment for fevers. It produces large quantities of the active ingredient when harvested along rivers in the foothills of China's Guangxi and Hunan provinces. Sweet wormwood can also grow in Europe, the United States, and Africa. Its active ingredients is a most precious compound. It cures malaria. The drug obtained from sweet wormwood, called artemisinin, and its derivatives like artesunate, has been recognized as the most promising anti-malarial drug available today. It is sometimes known as the miracle drug. It has given hope to malaria sufferers in the poorest parts of the world. China and Vietnam are the largest artemisinin producers in the world. In the past few years, sales have increased exponentially. The countries of Southeast Asia are able to produce the drug at a reasonable cost. They apply strict quality control measures and test the drug under rigorous conditions to ensure that it meets the highest standards. The largest number of users of artesunate are now found in Africa. This medicine has also helped to control the problem of malaria in the Mekong region, which has the world's most serious anti-malarial drug resistance situation. But a study has shown that a staggering 38% of shop-bought artesunate samples in the countries of the Mekong region did not contain artesunate. The cost, the physical appearance, and the packaging seemed to be authentic, but simple and inexpensive tests were enough to show that they were in fact counterfeit.
We've developed simple methods for identifying fakes, but to the untutored eye, or even now the tutored eye, even under a microscope, you cannot tell the difference between the packaging and the tablets of the genuine and fake product. So these counterfeiters have gone to extraordinary extent to kill people.
The manufacturers of artesunate have tried to beat the counterfeiters by using a hologram on the packaging. The result? The counterfeiters merely copied that too. In 1998, the first hologram found on counterfeit packets was quite obviously and recognizably fake. In 2002, a second generation hologram was better made, but still not identical to the genuine one. By 2003, a third generation hologram could hardly be distinguished from the genuine one. The counterfeiters are never far behind. But how do these drugs reach the public? The manufacturers are unseen and unknown. They operate in well-organized secrecy. No one dares to bear witness against them. Their ruthlessness is visible in the products they sell. Retracing them is difficult, even for the authorities of the regions most affected. Police investigations have tried to follow the trail from clues left on packages of fake drugs. But any name or addresses figuring on the box are fictitious. Even with the cooperation of the countries involved, investigations reach a dead end.
When we talk about fake drug, everything can be fake, including the address of the manufacturer. So we can find who import that, but the real producer can never be found. Even as I told you again, that even some licensed manufacturer, if they are not fair enough and they want to produce some fake drug, they will never show their name on the label. They may show some other name, some other phantom address, which can never be found anywhere. And this is the real difficulty to find out the real sources of counterfeit drugs.
Wherever the drugs are produced, they cross borders like all smuggled goods in ways that defy the ingenuity of border customs.
It's often those countries with the infrastructure to produce legal drugs in the first place that are have the infrastructure to produce counterfeit drugs. In the Far East and in Asia, there are particular markets that can be developed, and then the goods can be shipped around using express parcel carriage or even in marine containers, often coming through transit points and free zones, so that the original destination is somewhat disguised.
It is suspected that the counterfeiters are from the region itself, but they may be part of a much wider, even global network.
So, it is difficult for me to tell exactly where the fake articulate are made. They present mainly in the areas along the Mekong, so it is probably that they were made somewhere nearby. We have our own appointed investigators. We are the company, not the government body, only who has the right to execute the law. So we report what we found during investigation to local government to ask for help.
Once in the country, travelling salesmen and small unauthorised pharmacies supply the drugs to local vendors. These so-called anti-malarial drugs sold in local markets make up a colourful picture. But beneath these cheerful colours lies a sinister fact. These pills can kill. Still, the Cambodian health authorities are not giving up. They have decided to fight this ever-increasing threat step by step. Health officers periodically visit local markets to locate the counterfeit drugs that are being sold there. They have found out that fake artesunate is being passed off as a second-quality, cheaper variety of the drug, supposedly not as strong as the regular, so-called first-quality one, but still effective. Samples of both types of pills were analysed by the health authorities. The so-called second-quality variety did not contain any artesunate at all. Some years ago, another product sold as the anti-malarial drug mefloquine turned out to contain no mefloquine, but Fansidar, an anti-malarial drug that is no longer effective because of drug resistance. Following these tests, the Cambodian health authorities seized the counterfeit drugs and removed the licenses of the pharmacies that were selling them. They also tried to trace the wholesalers who supplied these fake drugs to the drug outlets. Occasionally, stronger punitive measures are applied. But this is far from enough to curtail the problem. The illegal drug outlets and vendors are too numerous to be identified on the regular raids of the health authorities. Often, they do not know exactly what they are selling.
Fighting with fake drug, not only one country can do it. We need collaboration and support from different partners, especially from WHO or from other international organizations, and also need the regional collaboration. Because as we mentioned that the drugs is not only in one country in Cambodia, they have other countries in the region. So the region should be have a plan to fight this fake drug together.
There is a need for concerted action both at national and at international level, and on several fronts: healthcare, legislation, and law enforcement. The World Health Organization is cooperating with Interpol and other major partners at the international level.
The difficulty with counterfeit medicines is that whilst they may be manufactured in one particular country, quite often they're readily available to members of the public and consumers in a whole range of other countries. So the very nature of this is that transnational and organised criminals are involved in the process. There's a great need for the World Health Organization and Interpol to work together with the national authorities, both within the police and also within the health authorities, to do what we can to come up with collective strategies to deal with this particular problem.
If proper legislation does not already exist in a country, there is a need to revise national laws to address this problem. Past experience has shown that fines are by no means a sufficient deterrent in this multi-million-dollar industry. When human life is at stake, the sanctions should be commensurate with the crime.
This is a crime. I think it's certainly manslaughter. It could well be murder. I mean, these are people who spend an inordinate amount of effort and time producing something that they know doesn't work for a disease which they know kills people, for a profit as little as 50 cents a packet. It's heartbreaking.
Legislation is thus only the first step. It needs to be supported by strict law enforcement and punitive measures. There can be no extenuating circumstances for these dealers in death. Everyone involved, including pharmacists and vendors, must know the full consequences and the cost of selling fake drugs. National health authorities can help fight the counterfeiting industry by ensuring a safe and efficient drug supply chain in sufficient quantities and applying quality standards and quality control measures throughout this chain. In some of the Mekong region countries, village volunteers from different districts are being trained to test for malaria and distribute anti-malarial drugs free of charge. They also educate and inform the community about the need to follow the right treatment for its entire duration. Periodically, technicians belonging to NGOs visit these communities to replenish the stocks of drugs. Controlling malaria and providing access to good quality drugs will help ensure that the counterfeit drug industry cannot force its way into the market. Alongside these measures, the public must be made aware of the real danger: ignorance. Information campaigns can bring home the fact that every time people buy a drug from an unlicensed vendor, they are putting their own life or the life of a loved one at risk. If nothing is done, this industry may well grow beyond control. It is becoming ever more wide-reaching. Fake drugs can now enter your homes through a click of the mouse, just as easily as they are able to reach a little boy in a small village in Cambodia. There are concrete steps that can be taken to fight the counterfeit medicine industry. But all those involved in this fight are aware that these steps cannot be taken alone and separately. All actors involved should collaborate to defeat these dealers in death.
I would like to stress to any ministers, any government ministers looking at this video, or any senior officials, to actually give the customs the proper empowerment to do this important job, to give them the proper resources and training, and try to link them in with the other enforcement agencies and the health organisations and the police services within the country, so that those agencies can work together to stop this problem.
There are three major strategies that we have to implement. First one is to increase the public awareness. And if people are encountered with the drugs which are really cheaper than the others that you buy in the official the outlet, you have to suspect there may be some possibility of counterfeit drugs. And the second strategy that we have to implement is rapid and transparent information sharings about those people concerned. These counterfeit drugs move very quickly across national borders, so we also have to move quickly at the speed of internet. The third strategy is to increase government political commitment. We need a multi-sectoral approach which involves not only health sector but law enforcement or the authorities and the regulatory authorities as well. But on top of the three major strategies, I think we have to make sure that the people have access to quality and affordable prices everywhere, every time.
To end the counterfeits is the main job of government law executing department. Drug is one kind of special commodity which should be sold on specific pharmacies or hospitals and should not apply an open sales mode or sold together with agricultural byproducts.
If we really want to roll back malaria, the drugs have to be made free effectively. And that will, through a central processing or procuring facility, you would then, of course, be able to ensure you had quality supply. And if the drugs are free, there's no incentive to fakes.
Every single one of us is concerned. This fight needs to be stepped up before the reach of this industry of the shadows becomes even longer. The simple gesture of taking a medicine should not be an act of faith, but of total security and confidence. It should be life-giving, not life-taking.